I'm Dr. Mark Quadra, and I'm hosting this chat on behalf of The Next Step. There are so many things as a graduate I wish I knew about that university just didn't prepare me for. And that's where the wonderful The Next Step comes in. I'm joined by fellow dentist Dr. James Foster and Dr. Tilly Houston, both currently working as associates, and Dr. Megan McLeod, who started her foundation training this year. Welcome, everyone. We're going to be having a chat about what it's like starting DFT. I've been working as a dentist now for 13 years, but I remember that the transition from uni to working life can be a steep learning curve. From seeing a greater volume of patients, navigating different dental treatments, balancing work with downtime, and possibly moving to a new city and finding somewhere to live, amongst other things. It's a lot to take on. So let's get started. So one of the first things to consider really is where you're going to live. James, you moved from campus to renting. How did you find that experience?
So I was quite lucky in that I graduated from Birmingham. I got to stay in the Birmingham area with my placements. I had a lot of friends who were staying in the area anyway. Ski mates as well. You make quite good friends with. You see them every single week and you do bond with them. It's very hard not to because you see them every single week. They're going through the same problems you are and you just generally commiserate together, and that really built a bond. I would say my immediate community in terms of where I was living, I didn't make any close friends because it was quite an old community, but they were very, very friendly, which made the moving out process a lot easier. I've not had to put my bin out a single time when I was there, so I got very lucky with that.
Wow, that's really, really nice. Tilly and Megan, what's your experiences been like?
Yeah, so I'm originally from Scotland, but I studied in Sheffield, so I wanted to get a bit closer to home. So I've moved to the northeast, but it was quite difficult at first because I lived in Scotland. I had to stay in the area to have a look at the viewings, and the properties were going quite quickly, so it was a bit stressful. But I was lucky to be looking with my fiancé, and we managed to find the one that we really liked. So that did work well in the end.
And Tilly, what's your experience been like?
So I did my FD kind of just as COVID hit, which was actually, when I reflect back, quite nice because I had the cushioning of just moving back home. I was fortunate that my parents lived about a half an hour drive from where my FD practice was. So moved back in with mum and dad, which just meant that jump out of uni and into foundation wasn't such a big one. We had kind of home comforts and then made the move kind of after FD.
It's such a big transition, isn't it, anyway? And then if you've got your parents that can help you with the things, it makes it a little bit easier.
You're washing,
That's a big one, I think.
Speaks out the stressing a little bit, doesn't it? Because you can just worry about foundation year, and then once you've got that a bit more under control, then you can start thinking about moving out and doing stuff then.
So Megan, you started DFT this year. How are you finding it?
So I think at the beginning it was quite challenging sort of adapting to being more independent because at dental school you're always getting everything checked. So it's difficult at first being confident in your decisions and also not getting everything checked as much as you would at dental school. So that was a bit of a jump at first. But I'm starting to settle in a bit more now after a couple of months and I'm really enjoying it.
Going back to day one when you first started, can you remember that experience?
Yeah, so we kind of had a bit of an induction at first, sort of meeting the practice and finding out about the policies. And then my supervisors would sort of give me a patient or two and see how I get on. And then it was a bit of a jump when you start seeing a lot more, because normally at dental school it would only be like one or two in a session, to then move up to seeing like 5, 6 in the morning. It was definitely a bit of a jump at first, especially with the timings.
And then just reflecting back on that experience, what's been like your biggest wins?
It's really rewarding being a profession where you can sort of give people their smiles back. I've had a few where I've restored their smile by giving them their front tooth back, and then just seeing how much more confident they feel after. It's very rewarding and reminds me why I'm doing what I'm doing.
Yeah, it's so heartwarming, isn't it? Particularly when you've had bad days or challenges that we all experience in dentistry, to actually have that positive compliment. So Tilly and James, what have your experiences been like with that transition from uni to FD or FD to becoming a dentist?
I'd say the actual workload part didn't really change a huge amount for me because I'd spent most of foundation year thinking to myself, I need to get into this associate mindset, I need to get my speed up, get my procedure times down. I said the biggest difference is just realizing that you're working for your actual money. You're not salaried anymore.
Yeah.
If you take extra time to do something, or if you want extra time to do something, or if you have a gap in your diary, it means you're not earning, which was a big jump because, you know, you're used to before being salaried, thinking, oh, I've got as much time as I want to do this. But you can still book that if you want to, if you've got supported practice, but you've just got to realize there's a balance between the two. That was the biggest difference for me.
It's like the business aspect, like putting your business hat on and really thinking about, you know, when am I going to have my holidays? How's it going to impact my month's salaries?
Go from uni not really having to worry about money at all to foundation dentist, where you're telling patients that there's a charge, and maybe a little bit of private, depending on where you are, to being thrown in the deep end of business where, you know, every decision you make will impact you financially.
Yeah, it's like a different way of thinking. I also found that you would go from uni, where you're surrounded by your friends and your peers who are all your age, going through the same thing as you. You then go into foundation, where you have still kind of like your scheme that you meet up with every week. So again, a smaller cohort, but still that you're kind of in regular contact with. So then going into associate kind of practice, where you can just be kind of on your own in the practice. There might be not be another dentist who's at the same level as you. All your friends are spread out across the country. So there's that aspect of it. That's what I missed about uni and foundation when I started. And I hadn't thought about that side of it. I suddenly felt like, oh, my friends are actually quite far away now.
Yeah.
And there was a little bit of that sense of, not that I'm on my own because I'm in a very supportive practice, but that it was me and my nurse in that room. But enjoyed it nonetheless.
Obviously going from uni and even FD, you've got that, like you said, that cushion, right? So it can feel a little bit lonely, I imagine, at times. But that's a genuine challenge, isn't it?
And just following up on that, I'd say one of the big difference going from DFT to associate is having, like you were talking about with the cushions, it's the very last time you have any kind of person who's directly there looking after you.
Yeah.
Because in uni, you got whole teams of clinicians whose only job is to make sure what you're doing is correct. You get a bit more autonomy when you go into DFT because you've still got your NHS supervisor there. But it's up to you really whether or not you call them in. But at the end of the day, they're still there to look after you.
You know they're there.
Exactly. If you ever need it, you know, you can just say, oh, I just need to go and have a quick chat with someone. But as soon as you go into associateship, there's no one there who's being paid to look after you.
Yeah.
There's no one there whose job is to look after you.
Yeah.
So you do have that autonomy, which is very exciting.
Yeah.
And a little bit scary at first.
Yeah. How do you manage those anxieties and being okay with your judgment rather than relying so much on someone else? Like how do you like cope with that?
I think it's taking the opportunity in DFT to say, I've got my safety net there, but I'm going to try and go a bit independent. It's a bit like when you're riding a bike and you slowly move the support wheels up a little bit. You've still got them there, but you're not using them while they're still there, trying to make sure you can do it independently without having to. But also it's about your practice selection when you go to associateship. One of my key questions I always asked when I went to go and view practices was, if I have trouble with the case, is there going to be support for me? So one of my practices was being really supportive about it and said, you know, the surgery we're going to set you up in is right next to the most senior dentist. So if you need any help at all, just pop your head out and let them know.
Brilliant. That's so, you feel so reassured, don't you, when you've got that comfort and there's an open door policy, right? Tilly, have you found that as well?
Yeah, I think being in a supportive environment is a really big thing. But the other thing that I found just like that really helped me is you don't have to give the patient all the answers then and there. Sometimes you feel like you're with the patient, they're going, okay, so what do I need to do? And you're like, oh, I just really want to ask someone, but you don't want to come across like you need that kind of assistance. And so often I would kind of just give myself that bit of time by saying, look, okay, there's a lot going on. I actually want to take the time to think about this, and so I can get the best plan for you. So let me get you back next week once I've had some time to think about it. And then in that time, you can quickly go and ask everyone that you need, like, what are we going to do with this?
Oh,
So yeah, just giving yourself some time, I think, really just kind of took the pressure off a little bit.
Yeah.
And following up on that, I found the biggest thing that helped me was not having to think I have to come up with all the answers for the patient and tell them what the best thing to do is. Because I kind of have that mentality going through uni and DFT, which is you've got to figure out the best thing for the patient and basically still discuss it with them, but basically say, like, this is the best option. I've realised now it's just better just to give the patient all the options, all the risks and benefits, and then they can decide. And that takes the pressure off you massively, because you don't have to think, oh, if I do this and this goes wrong, what happens then? You just give them the choices.
Yeah, and I find in foundation year as well, it's trying to find a way where you think, oh, I should probably get my supervisor for a second opinion without coming across that you don't know. It's quite challenging at first. So normally we'll say, there's a lot going on here, so I'm going to get a second opinion and work out what the best plan is for you. And it's saying it in a way that doesn't they still have confidence in you, because that can be quite tricky at first.
Yeah, agreed. Like, I think that's so important, the language that we use. It's you're being comfortable enough to talk to your trainer or talk to your peers, as well as, sharing with patients that actually, I'm going to just spend a bit of time, reassure them. And I think it's actually better for clinical care, isn't it? Like, we get a chance to really get some ideas from other colleagues and come up with a better treatment plan.
I think they appreciate that you're taking the time, that you're not rushing into it as well. They know that you're going to do the best for them.
Absolutely, yeah, because I've had one patient come who needs quite a lot of restorative work doing, and I told them, I'm not comfortable completely doing this myself, but what I'm going to do is I'm going to chat with our practice principal, who's a lot more experienced with this kind of thing. We'll come up with a treatment plan together, and then we'll present it to you. It was really, really appreciative that, we didn't just kind of say, oh, it's not something we can do here. We took the time and thought it through and gave him a plan that was well considered.
What were you most excited about when it came to DFT?
I think I was most excited to just get out there and do what we've been trained to do. It can be a bit frustrating in final year of dentistry, almost having too much support. You want to go out there, you want to see a bit more, do more treatment. So it's quite nice to actually be able to do more of that.
Yeah, I completely agree with Megan. In your final few sessions of fifth year, I was getting almost frustrated with how much I had to go and check every single thing. I'm like, come on, I'm graduated by this point. This is just a formality, but I'd have to keep going to check everything. So I was really excited to have a bit of autonomy and just be able to decide on my own, right, this is fine, we can move on to the next step now.
Yeah, I think for me, same as these guys, like having that independence, be like, okay, I can make these decisions myself. Also getting paid, that was great. Like being paid to do it was a big difference. So that's always nice.
Your first patient is great.
Yeah.
And just the converse of that, so what's been the biggest kind of challenge or the thing that you were most worried about starting?
I think for me, something that you're not really used to at dental school is talking about money, because nobody pays at dental school. So I was a bit nervous about, for example, with like periodontal treatment, trying to explain to them, oh, actually that comes under band 2. Like that sort of conversation about money is difficult at first.
I think for me, like the main thing I was worried about was just not being able to do something, or just kind of that feeling of being on my own and not having support, or trying to take a tooth out and it's not coming out. Who can I call? Don't know about you guys, but I found in the different practices that I work at, everyone is so supportive. There's always dentists around the corner that are happy to help. That's what's great about the profession, is generally everyone is really supportive of each other. Everyone's been in that position and knows what it feels like. Looking back, it's not actually been that something to really worry about, but I was really worried when I started.
So foundation training can be really, really daunting. I was really surprised though how much support that I received. What's been your experience then in terms of the specific support that you get in FD year?
So I find that the schemes in general are very supportive, particularly with the study days. We had one recently on communication where we had some actors come in and pretend to be sort of really difficult patients. I find that was really beneficial because we could all sort of get together and discuss different experiences. So it's nice to have people who are going through the same thing to sort of bounce off the challenges that you've been having. And then we've got another one coming up where we have to sort of submit a difficult case from communication or clinical, and then we'll sort of sit down and discuss it. And it's really nice to, again, be able to speak to your peers and even your TPD. And even at the practice, you've got your supervisors, so if you've got any problems, you can go to them. So I've felt very supported.
I felt there's kind of two different ways they can really give support. There's kind of the official route with your NGO supervisor, your TPD, who's paid to look after you and make sure you're doing well. There's a mental health supervisor as well, who's specifically tailored to look after you. And if you're having trouble in those kind of areas, they look after you. And they can flag up if there's any kind of areas in particular you need more support in, like extractions or something, and they can arrange for more study days. But then there's the unofficial support network as well, which is your peers, your family, your friends, who you can always turn to when you've had a tough case, or if they're not dental, just talk about and just have a little commiserate. That's always really helpful.
It's really interesting to learn about the mental health support aspect. Can you tell us a little bit more about that?
I went to the Midlands region.
Yes.
And one of the TPDs there is specifically in charge of mental wellness. So if there was anyone flagging up any kind of red flags, like your ES, your TPD, anyone at all, they'd kind of shoot it over to her. She'll have a little conversation with you, see what kind of support, if you needed any help or anything. And I know the deanery was very, very supportive in that. If you needed to reduce your days for whatever reason, if you needed to take a little leave of absence because you had a family matter or something like that.
Brilliant, isn't it? Because you just don't hear of deaneries particularly doing that. So that's fantastic. I think creating that culture where you feel safe and it's positive is really, really important. rather than like a toxic culture where you just literally can't share what's going on. So yeah, brilliant. And Tilly, what's your experience been like?
So yeah, just going on from like the peer support. So I was in my FD practice, there were 2 of us FDs, and I found that just so comforting to have someone else there with you, because although you both know as little as each other or as much as each other, there were times where you would actually just get each other's opinion, or the other person was around, get them in. And when you're sharing that together and going through it, it just kind of relaxes you and makes you feel like you're not on your own. So I found, as well as kind of my ESs and the TPD and the formal structure, like you said, I found being in a practice where there were more than one FD really, really comforting.
And then in terms of the practice as well, were there any specific things that they were doing to help you feel a bit more comfortable in terms of support?
With mine, the first sort of week that I started, they kind of held like a little welcome party, which I think was really nice. So they had like, they even had like a DJ and like a big Thai buffet. So it was quite nice to sort of get to know everyone outside of the work. And I think that made me feel more comfortable.
Yes.
To be able to approach people rather than just being the new FD in the room.
Sounds like they put a lot of effort into that, which is really nice. It makes you feel really welcome, doesn't it?
It does.
Yeah. And then do you have social days as well in terms of your teams that you all kind of go out and get to know each other and just away from dentistry a little bit?
Yeah, definitely. So Christmas parties, great time. Whenever the practice principal's feeling generous enough, he might pay for a day out or something. Or even just going for drinks at some point. Just getting to know them a bit more outside work. Or when you move it down to when you don't have a patient in the chair, just chatting with your nurse, getting to know them a bit. We do a Christmas party every single year, which is really nice. This just past one, actually, I went to 3 in one night because I had my scheme's Christmas meal, which I then finished early, left, went to my practice's Christmas meal. And then my girlfriend was having her Christmas dinner at the same time. So I left that one to go and join their Christmas party. This whole time it was after a study day, so I was carrying my loops around the whole time.
And you didn't lose them?
No, I didn't lose them. I was very careful. And in fact, they helped me get into a nightclub.
Oh, really?
Yeah.
Okay.
Because I got to it and they'd said that we're not going to let any new entries in. And I was like, oh, okay, that's fine. And then the bouncer was like, what have you got in that big case? And I was like, it's my loops. It's like, loops? And he's like, yeah, I'm a dentist. He was like, can I see? And I was like, yeah, sure. Opened it up and then he was like, you can go in.
The perks of being a dentist,
Clearly,
right?
yeah. I'm not doing it again, but it got murked once.
Brilliant. So we tend to learn a lot about ourselves when we do something new. What's the biggest thing you've learned about yourself just working in practice?
I think for me, I've learned that I'm actually a lot more patient than I realised, even just from getting feedback, particularly from anxious patients. Because some people maybe wouldn't have the patience to take the time and work with them towards getting over their anxiety. But I think that's the biggest thing I've learned.
I'd say it's not specifically about me, but the way I think this generation of dentists has been taught is that we tend to be a lot more gentle and kinder, because I'll have many patients come in and tell me a horror story about a dentist, or they'll finish it and say, oh, you were so gentle. I'm like, I didn't think I did anything special, but thank you.
I learned that I was not as patient as I thought I was.
Okay.
I thought I was quite a patient person. And I think just dealing with all sorts of different types of people, children, elderly, difficult patients, you really do have to just like be more patient, let people tell you everything they want to tell you. And I've learned it now, but I wasn't at the start.
So have you had any issues with patients or colleagues that you needed to resolve, and how did you go about doing this?
I've been quite lucky in that all my colleagues I've worked with across my DFT practice and my 2 practices I'm working at now have all been very, very nice, very, very helpful, supportive. So I haven't really had any issues with them, which is quite nice. I think no matter where you work, you're always going to have issues with some patients. Most of them can be resolved just by sitting down and having a good, honest conversation with them, because sometimes it's just about a bit of miscommunication. Sometimes it requires them seeing another dentist, almost a bit like a good cop, bad cop scenario, where you tell them the bad news, they get a bit angry and frustrated, but then they go and see another dentist and they're more open to actually recourses about how we can actually treat that. I've only actually had one scenario where the patient, the relationship between me and the patient's broken down so much that we just had to say we can't see you at this practice anymore. But, just trying everything we could before I actually got to that.
Yeah, it takes a lot of courage, I think, to really realise that actually it's not working out, and also just really putting your focus on what's really best for my patient is perhaps seeing someone else.
I generally try and have as good a relationship as I can, but there are, like James said, there's always patients that you just don't see eye to eye. And I think it's important to know that as dentists, like patients can choose which dentist they go to. You can say, look, I don't feel like I'm the right dentist for you if you don't feel comfortable treating someone. In my first kind of few months out as an associate, I actually one day was working in reception. We're like, Tilly, we've got someone on the phone for you. And I went downstairs and I answered the phone and they're like, oh, this is so-and-so from the GDC. We've had a complaint about you. And I was like, okay, like, what have I done? The process was so stressful, the back and forth. So yeah, that was probably one of my trickiest moments that I've dealt with so far. All is fine now and resolved, but at the time it was all I could think about.
So what are the positives from that experience, do you think?
So when I actually reflect and look back and think, okay, why did that happen? I've realised that perhaps I didn't explain to her why I was doing an onlay, that I was trying to conserve as much tooth structure, which makes it more difficult. The fact that I'd put a temporary on there so it can come off because we need to be able to remove it. So I don't think maybe I'd explained that as clearly as I thought I had, which I then learned from. And I'm now so clear when I explain that, when I put a temporary onlay on. I think that's something that I've really now worked on is my communication, making sure as dentists, there's a lot of things that we do that is kind of really obvious to us, but forgetting that the patient might not be aware of it.
Very hard to find that balance, isn't it? Between how much do you explain to a patient and how much do you try and simplify for them?
Yeah.
Remembering to actually have that communication and that conversation with them so that you don't have anything crop up like that.
And I think every patient is also so different. Like some patients, you can just give a little bit of information and they're fine, where others want to know every single thing.
Yeah.
So it's trying to also find that balance from patient to patient as well, which I think comes just from experience and speaking to so many different people, I guess.
Although it sounds like it was really, really tough emotionally, I imagine you're so much more resilient now, and I think that's so positive. And Megan, what's your experience of this?
Had a bit of a difficult one with my nurse because she's sort of fluoride trained. And at the study day, they were highlighting that even if they're under 3 high caries risk, if you could manage to get fluoride on, you should. But my nurse was sort of very much, we don't do any fluoride on under 3s. So it's a difficult one when you have the patient there because you don't want to say that in front of the patient. But I think it's important to just be clear with the nurse, like have a discussion with them on what you've been told that you need to do. And even just, it's difficult at first learning how you work with your nurse. So you just need to be honest on what you want from each other and just be open to their feedback as well.
And just following up from what Megan said, when you've got a really good relationship with your nurse, what I did with my first couple of months of DFT, which is after a day had finished, I'd just turn to my nurse and say, is there anything you think I could have done differently this today? Anything I could improve? Because realistically, you come out of dental school, they have way more experience than you, particularly when it comes to patient communication, relationships, that kind of thing.
So James and Tilly, you're both working as associates now, both in different types of practices. Thinking now about career development, how early on in working life do you think you needed to start thinking about those career options?
I kind of had an idea of the sort of dentistry that I wanted to do. And so going into FD, that also gave me a little bit of a flavour of the practice that I was in, did a lot of the kind of treatment that I was looking to do. And then I guess from finding a job, trying to navigate what's the best time of year to start looking, how do I go about kind of applying, where do I want to be? I think generally start by thinking where geographically do I want to be, and then zone in and look at some practices that you think that's where I would fit in well. They do the sort of dentistry that I would like to do, and they have the ethos and the values that match mine. And there's no harm in just handing your CV in, even if they've not kind of put a job application on one of the websites. Just handing it in and saying, look, I'm going to be starting to look for another job next September, or if you ever have any vacancies, let me know. I'd really be keen. I think to anyone who then they would think of you and get in contact if they were looking for someone. So that would kind of be my advice, is don't wait for a job role to come up. If there's somewhere you really want to go, just go for it.
Completely agree with Tilly. The earlier you can start thinking about it, the better. Particularly in dental school, you don't realise it at the moment, but you're in an invaluable position where you're surrounded by specialists and consultants. You can walk 2 minutes and ask someone who's got so much more knowledge than you do any of these kind of questions. So you can really start exploring your options there. DFT as well, great opportunity. I started ranking my practices based on what kind of specialties the ESs were interested in. Because if I had a rough idea of what I was interested in, I wanted someone who kind of had those interests as well, and I could explore a bit more with them. And then after having finished DFT, I'm now starting to look at postgraduate courses. I did have a little thing in my mind before we started, in that, maybe I should settle into associateship first, just do the job for a bit. But now I've kind of come to the end of that. I'm starting to think, all right, I'm ready to kind of take the next step in professional development, and I don't really want to wait.
I do think, though, that there is no rush. Like, there can sometimes feel like a pressure because your friend knows what they want to do and where they want to go, and they've got the job that they want. But actually, so many of my friends were like, oh, I actually enjoy a bit of everything. I don't know if there's one particular area of dentistry that I want to specialise in. And that's fine. Just spend some years doing a bit of everything, learning about yourself, getting your skills kind of to where you want them. And you'll soon find the things that actually you look forward to in your day. Usually they're the things that you're good at. So then you can kind of navigate it from there. But your career is so long. There's no rush to kind of be where you want to be 1 or 2 years out. Like, it's a journey. And so, yeah, I think that's really important, not to just rush because you see other people around you doing that, I guess.
Definitely. And the other kind of scary but also exciting thing about associateship is that it's the first time really in your life where your education is self-directed.
Yeah.
For your entire of your education degree, all the way from secondary school to university to DFT, there's someone else telling you this is what you're going to be learning, whether you like it or not, really. But now you've actually got there, if you want to take the time to figure out what you like, and that can take a couple of years, and that's completely fine. But once you're there, you get to decide what you want to learn.
And you can say, I'm not doing any endos, and that's fine. Someone else will do them.
Yeah, I think just having that excitement really about, choosing where your career could go, and if there is a passion or a strength, really kind of delving into different courses and, like you said, conferences, that can really open your eyes into like different types of dentistry. So James and Tilly, becoming an associate effectively means being self-employed. Do you think young dentists actually realise what this concept of self-employed is? Because I know at uni, I don't think we weren't certainly taught about this. And it's a completely whole new ball game, putting your business hat on. So what's been your experience of this?
I see just the biggest difference is when it comes to getting paid. I didn't realise until just before I started associateship how really the NHS pension system works and taxes work, and realising that I need to start saving for those things, because what some people might not realise is that when you're a self-employed individual, you just get paid the full amount for your paycheck, but then come April, it's your job to then pay the government what they're owed in taxes. And if you haven't realised that and you haven't been saving up to that point, you've just got a massive bill with no savings to pay for it. So that was one of my biggest things I had to get my head around and realise, you can't just spend all of your paycheck.
Sadly. Yeah, it is. It's such a shock, the money and the finance aspect of it, and becoming self-employed. I didn't even know what that meant, and I didn't even know there was an option of limited company, and I'm still learning, to be honest. I wouldn't say I'm the most clued up, but there are a lot of resources out there. But yeah, one of my principals brought me in. He was like, we need to do this form to prove your self-employed status. What even is that? Like, I wouldn't have known had he not told me. So yeah, there's a lot of things where I find just having a network of other people who, like on our friendship group chat, someone will say, guys, have you done this? And everyone else is like, no, what's that? So I think definitely...
Even worse when they say, yes, we've done it. Like, no, I haven't done it.
Yeah, just having open communication with your friends so that none of you like miss anything.
My foundation year was very supportive when it came to that aspect. We had 2 separate study days about financing, particularly from dental accountants, and Wesley as well came together as a talk. So, you're not just chucked in the deep end when it comes to becoming an associate. You do have resources to draw upon, and there's always people around you can ask.
So what advice would you give to your younger self?
I think for people particularly in like final year of dental school, try and be a bit more independent. So if you've got any placements, try and think in your head before you get your supervisors, because I found that helped when I started foundation year, having that sort of trying to push yourself more to make more decisions, but you've still got that safety net. And then if you're wrong, you can learn from it. I think that's an important one.
I'd just say it gets better. No one is disputing the fact that dentistry is a very hard career, even when you're in university. And it does feel quite overwhelming, particularly when you start doing the practical stuff and even when you get to DFT here. But as long as you've got a good support system around you, it will get better.
And I think mine, when I look back on my FD year especially, I wish I just slowed down. It's the 1 year where you're not paid for the work that you do. You're paid a salary. So take your time, just learn to get good first. You've got the rest of your career to get quick. So I wish I'd done that.
Yeah, I love that. That's really, really useful.